Welcome to the Wild Wisdom Podcast with Dr. Patricia Mills. I'm Dr. Patricia. This podcast is for people who want to transform their health, restore their hormones, and reconnect to their body's natural wisdom. Hi, I'm Dr. Patricia. I'm a Canadian medical doctor, published author, internationally recognized researcher, and passionate advocate for your health. Here, we'll explore the intersection between ancient wisdom and cutting-edge science, distilling the essence of true health into practical steps you can take. Wild wisdom is instinctive knowledge in action. Thanks for making this part of your day. Functional medicine is a relatively new stream of medicine. So when we go into medical school, when Western medical doctors go into medical school, we all have our basic training in medical school. And then you have to go through, at least in Canada, family medicine training. So you get to decide if you want to go into family medicine or specialize. And the difference has a lot to do with the time. So with family medicine, it's a shorter residency. And specialized medicine, it's a longer residency, doing a deeper dive on a more specific area. And when it comes to doctors who are doing functional medicine, those are doctors who are interested, have become interested in, not so much, just diagnosing. I don't like to use the word just, but there's the diagnosis of disease, and then there's the treatment with respect to prescription medications. And that seems to be the focus of a lot of our training. There is very minimal training on nutrition and very minimal training on exercise. Now, I am a specialist in physical medicine and rehabilitation, which means that I did get more in-depth training in exercise, so prescribing exercise as medicine. And there's some very basic training, again, provided on nutrition, but it's more in the line of, adequate hydration and meeting your calorie goals and energy requirements in that way. Whereas functional medicine doctors, these are doctors who are interested in what's called root cause medicine. So it's getting to the causation of why the individual got sick. And when I learned that about 95% of all chronic diseases are actually environmentally triggered, so there is a genetic underlying component for many of these. However, it's something in the environment, something that we put in us, on us, through us, or our mindset that triggers that underlying genetic predisposition to express itself. So it's like the genetics load the gun, but the environment pulls the trigger. And, functional medicine looks at what pulled the trigger. And oftentimes it's not just one thing, it's many different things. And what's really, really neat about functional medicine is that it's very, very science-driven. And it's very interested in looking at the very up-to-date science. So we know that on average, and it depends on where you look at this statistic, but on average, it takes about 17 years for research results to filter down into medical school training. So by the time something's discovered, that could be life-changing for an individual. It could take 17 years for the doctor to just simply know about it. And sometimes, depending on what it is, it doesn't even get into medical school because there's only so much time and so many things that can be taught. And then it depends on who that person trains with in residency, like what doctors do the training with that person and what they're exposed to at that level. And functional medicine is looking at the very, very up-to-date research on areas like the gut health and microbiome, on toxins and how that affects our health, on nutrition and how that impacts our health positively or negatively, and looking at the very up-to-date science on that. And what's really, really interesting about functional medicine is when you look at the history of it, like how did it develop over time? Like physical medicine rehab developed primarily after World Wars I and II. So people were getting seriously injured and surgeons were operating on these individuals for brain and spinal cord injury and amputations. But they were mostly young individuals, right? Young men. And so these young men needed additional medical help afterwards. And that was in the range of exercise and medications and injections. And now it's, all of these other things like ultrasound therapy and that kind of stuff, right? And for functional medicine, the root causation of functional medicine is there were a bunch of doctors and not just medical doctors, but naturopathic doctors, chiropractic doctors. These are individuals who were in the health and wellness industry, and they were doing their usual thing, and they themselves or a loved one got sick. And that prompted them to, use everything they could at their disposal in terms of their own practice and their own training. And they felt like myself, when my dad was diagnosed with ALS, Lou Gehrig's disease, amyotrophic lateral sclerosis, you get to a point where you feel like you've exhausted everything in what you've been taught in your core training, and you're just not satisfied. You're like, you know what? I feel like there's more out there. And so these doctors from all fields of wellness, health and wellness, individually in many different parts of the world, started looking into the research, diving deeper into what was out there, looking into different texts like Ayurveda and traditional Chinese medicine, and starting to notice these commonalities amongst all of this research and texts. And interestingly, all of these people in different parts of the world started coming to the same conclusions and finding the same, what I call threads of truth, and applying them. And the movement really picked up quite a bit in the United States with, doctors like Dr. Jeff Bland, who were sort of founding fathers of functional medicine, and then other doctors like Dr. Mark Hyman, who have established training centers, so Functional Institute for Functional Medicine, places that you can train to become certified in functional medicine. And the core teaching really revolves around finding the root cause. So in a Western medicine doctor's office, oftentimes what happens, not all the time, but oftentimes you come in with a problem, investigations are done, and when something is found, you're given a diagnosis, and then the doctor tries to find a prescription or a medication that will make you feel better, and the prescription is provided, and then it's like, okay, goodbye. Come back for refills or for titrating or to see if the prescription worked, but eventually you find the dose of medication that works for you, and then over time it gets adjusted. Whereas in a functional medicine doctor office, it would say, okay, you're coming in with these feelings and sensations, signs and symptoms of your body, that body language that's telling you that something is not right. Let's do what we need to do to make you feel better right now. So that can involve a prescription. And let's begin the journey of finding out, why did this happen? Why did you develop type 2 diabetes? Yes, there's a family history of it, but that doesn't mean you're predestined to have this, right? Genetics is not your destiny, right? The genes are basically like, and I've used this analogy before, and I'm going to use it here again because it's relevant. Your genes are like the piano that you're born with. But like with any piano, you can create many different kinds of songs with the same piano. And with the same genes, you can create many different health outcomes. You can range from being very unhealthy to being vibrantly healthy with the same set of DNA, because it's how that piano is played. It's how that DNA is used by the body, is interpreted by the body. The DNA is also another way to look at it, is like a blueprint, right? You have this blueprint, but it's how the architect interprets the blueprint that you get like a different kind of house and what kind of equipment. Like if you give it really good quality construction material, you're going to get a strong, robust house. But if you give it poor quality construction material, through your diet, for example, or what you drink, you're going to get a weak, brittle, fragile house. So from the same DNA, you can build a strong body or a fragile body, right? And so functional medicine recognizes that we can't just say, oh, this is your family history, this is your genetics, although there are a few, as I said, 5%, where it's like, nothing you do, you're going to get this thing. But it's actually not that common for that to be the case. And so it's very empowering to be a functional medicine practitioner, because when you go through the training, you are taught the underlying physiology, like how the body works, in a completely different way. Like in medical school, we are taught the basic physiology, but it's taught in isolated pieces. Like here's the heart, and then here's the kidneys, and then here's the ovaries. But with functional medicine, we're taught how they all interact and how one system failure affects another system failure. And now you've got like a whole systems kind of failure and how that works. And when you understand that, you can start making changes. And then when you learn about the nutrition, and you can start to understand how nutritional deficiencies can affect those systems and how it's a domino effect when that happens. Toxicities can affect those systems. How your mindset is, right? Like the mind is the builder. If you don't have the right mindset, your mind is going to give your body instructions on how to behave and how to build itself differently than if you have a very positive outlook or a very good way of coping with stress, for example. So when I found a functional medicine, at the time that I came across it, I had already come to my own conclusions about the threads of truth and the essence of true health. And I was wondering to myself, am I the only one who's coming across this? Like, this is so incredible knowledge. I just want to spread it to the world, And when I found functional medicine, it was like this aha moment, this deep peace. I just felt like, oh, thank goodness other people have done this. Like, I don't have to fight that battle. It's been fought, it's been established. There's incredible training to be had. It's very evidence-based. And when I say evidence-based, I'm a researcher. I'm published. I present my research at international conferences. And when I read the research, it's not just the randomized controlled trials, which is like the holy grail of pharmaceuticals, but it's the research that's available through observing how people actually respond to the treatment that you provide. So, for example, I know that, I've worked in diabetes clinics in Western medicine, and the observation of how people respond is that the expectation is that they tend to get worse over time. You keep giving them the medication, the insulin doses go up slowly over time, they get worse. Whereas with functional medicine, the clinical observation is that these individuals not only get better, they can completely reverse their condition and no longer have a diagnosis of diabetes type 2. The combined clinical experience of all of these doctors around the world who are following these principles of functional medicine, really getting to the root cause, which is different for each individual. There's many commonalities, but each individual has their own unique road that got them to where they are, so to speak. It's really inspiring to see, and I've observed this myself. I get my clients off of medications or on much lower doses, which is amazing. I see improvements in things that technically, like, you should not see improvements in, according to the Western medicine paradigm. So it's a new paradigm, okay? And it's a wonderful, wonderful way to practice as a doctor. And as a health transformation expert, that's where I get a lot of my knowledge from, is following the functional medicine literature, which is drawn from many different realms, right? There's not like one journal that you can read for functional medicine research. You have to pull research from all of these different areas of research and look at it as in a holistic way, like in a big picture kind of way, and see how it fits in to the big picture of the human frame and what is required to maintain the human frame in its optimal condition. And that's a way that we weren't really taught to think of in Western medicine. So I do believe that there's a role for Western medicine, of course. The role for Western medicine is it's really great for acute care. Okay, so if you break a bone or you're involved in a terrible car accident or spinal cord injury or something like that, and you need surgery, you need Western medicine. Right? It's like you're not going to supplement yourself out of that or nutrition yourself out of that. However, if you want to improve your outcome from that acute event, then you would layer on functional medicine principles, right? And so you would optimize your outcome with nutrition, like even brain injury, concussion, spinal cord injury, amputations, skin, all the burns, all of those things can be improved with the right nutritional approach. And then the chronic diseases, once you develop a chronic disease and you're feeling really, really crappy and you don't even have the energy to get out of bed, or you have so much pain that you can't function, there is a role for medications to make you feel better. And there is a role for medications in certain conditions where we know that if we can't get on top of it really, really quickly, your outcome's going to be really poor very soon, right? And then we'll need those medications as a bridge, but they shouldn't be like the stop sign. They should be the bridge that takes you to the path that you then continue on your journey to find out what it is that caused that chronic disease and how it is that you can reverse it or improve it, right? So I think that the ideal way to approach health is when you have a marriage of different approaches where you optimize and you leverage the strengths of each different area. So you might use a little bit of Western medicine, functional medicine, Ayurveda, traditional Chinese medicine. You're kind of the cream of the crop. You select the best of the best for your own personal situation. And what that means is oftentimes it's not going to be one person who's going to be serving you, right? You're just like when you start a business, you can't have one employee who does all of the things for you. You're going to have many different employees with different strengths, and they're going to have different roles, and you're going to use them all together to create a wonderful business. And that your healthcare is should be like that. If you're a person who just goes to your family doctor and things start to go wrong, and you just stick with your family doctor all the way through, I mean, you're going to either you have the most amazing family doctor who's trained in all of these different areas and has an incredible knowledge base, which if you do, please let me know, all of the fields of medicine, right? Including Ayurveda and traditional Chinese and all those things and functional medicine. But even the best functional medicine doctor doesn't have all of the answers. So you're going to, partner with a functional medicine doctor, another, someone else who maybe it took a deeper dive. Like if you're someone with mold, you might need to find someone who has a passion for mold. There are some doctors who suffered from mold exposure, and their life's mission is to know everything to do about mold. So, depending on what you have, you're going to have to layer on those people in your life. And what I like about functional medicine is it went, it's into the very, very up-to-date science. And also, functional medicine doctors, I find in general, are extremely humble in a way. They're very open to learning about new things and new ideas and incorporating it in, because in order to get to where they are, they had to have an open mind, right? Because you had to open yourself up to a different way of thinking, a different type of medicine, a different type of practice. And most of them tend to keep that attitude. So they're very open to learning and to looking at the data and reevaluating and open to changing their mind about something that may not be serving their patient and getting curious about why is this not working for this individual? What can I do? What can I change? What do I need to learn in order to help this person? So it's a type of medicine. It's also a philosophy and a culture. Functional medicine practitioners are incredibly connected to the idea of the mind, body, spirit, like the holistic approach to health. How you can make yourself sick with your mindset and with being disconnected from your internal energetics, so to speak, having a hard time with being a human being on this planet. The word spiritual is interesting to me because I'm not a religious person, but I have become a deeply spiritual person as I have gone deeper into research and to scientific research, which is so interesting because how would you become more spiritual? By diving deeper into the science. The more into the science that you go, the more that you learn that there are things that we simply do not understand that are not explained by science, and yet it exists. There's an energy that is just beginning to be able to be measured by certain scientific instruments. And what we realize is that it's not that energy was never there, it's just that we didn't have the instruments, the technology to measure it. And then the question is, what is that energy? What is it that it permeates our tissues and animates our body? And how is it that energy can become affected negatively depending on what's happening to us and what we're thinking, how we're dealing with the world, how we perceive the world. And the more that I'm into this practice, the more I realize that for me to get someone really healthy or to help someone get really healthy, I need to help them with that piece as well. And functional medicine doctors, they would hear me say this and they would totally get it. Western medicine doctors, and I don't like to be stereotypical, but generally speaking, they may not understand that connection to health. And so I feel very connected to that aspect of functional medicine. And I'm so grateful that it exists and has come into existence because it has become incredibly necessary in this day and age. And it is the way one of the ways of the future, not the only way, but a very necessary piece of the puzzle for our humanity to progress forward out of this pandemic of, chronic disease and ill health, which no one deserves. This is not our destiny. It's a side journey that we're going to have that is meant for teaching us things about ourselves and the way that we interact with the world and how the world interacts with us. And so we're going to learn a lot from it. And certainly a lot of people are suffering along the way. And I hope that by being a part of this movement, I can help minimize the suffering and increase the learning so we can just blow by this phase in human history a little bit faster. Thank you for taking the time to listen to this podcast, Wild Wisdom with Dr. Patricia Mills. If you like this podcast, please take the time to like and subscribe, and please feel free to leave any comments and look below for the contact information if you want to connect with me directly. Thank you, and I hope you have a wonderful day, evening, or night.
Hi everyone, I hope you enjoyed this episode. Just a reminder, this podcast is for educational purposes only. This podcast is not a substitute for a professional care doctor or other qualified medical professional. This podcast is provided with the understanding that it does not constitute medical or other professional advice or services. If you are looking for help in your journey, it is important that you seek out a qualified health practitioner. If you would like to work with Dr. Patricia for her expert health transformation guidance, please email her at info@drpatriciamills.com to book a discovery call. You can also find Dr. Patricia on Instagram at Dr. Patricia Mills and Facebook at Wild Wisdom for Women with Dr. Patricia Mills, MD. For access to all of Dr. Patricia's educational videos and more amazing perks, consider becoming a Patreon member. Links are in the description of this episode. It is important to have an expert in your corner that can help you make the changes you crave, especially when it comes to your health.